My name is Myra, and today I'll be giving my informative speech. These are my 3 note cards. Oops, sorry. Front. Nothing in the back. And then my audience, I have 5 people, family and relatives. Okay. Now to begin. Imagine taking a relaxing hot shower one evening when suddenly the room goes dark, and then you realize you can no longer see from one of your eyes. The feeling of disparity and confusion is an understatement, according to my friend Elizabeth. This is my friend Elizabeth, and the story that I just mentioned is Elizabeth's first experience and encounter with MS. MS is multiple sclerosis. Multiple sclerosis is a disease that is not often heard of. In fact, it is so rare that according to the MayoClinic.org, less than 200,000 cases are diagnosed per year. In comparison to the population of the US, that is about less than 1% of cases that are diagnosed. I hope to be able to inform you all more of this disease by identifying what MS is, what the risk factors are, and lastly, how it's diagnosed and treated. Since I am a healthcare worker in the pharmacy setting, I hoped that you guys can entrust that I have experience with patients who have MS, and also I do have experience with dispensing MS medications. Learning about MS will not only give you more knowledge of the disease, but it will also give you the opportunity to help spread awareness of the disease that is not fair to all. So I'm sure by now, a lot of you are wondering, what is MS? In short, MS is a chronic disease that affects the central nervous system, specifically the brain, the optic nerves, and then the spinal cord. MS is categorized as an autoimmune disorder because the immune system attacks the nerve fibers and the myelin sheath protective covering on those fibers. In this demonstration, you can see there's 2 neurons. On the right is a healthy neuron, and on the left is a neuron affected by MS. Inside the right-hand side, you can see the healthy nerve fibers protected by the myelin sheath. On the right-hand side, you can see exposed fibers, damaged fibers, and redness. To elaborate further, when the nerves are damaged, this creates a signal failure, as you can see here. This is a clear signal. This is a signal failure. When this signal failure happens, it is displayed in the person in forms of symptoms. The symptoms are blurred or double vision, loss of vision, red-green eye color, distortion, trouble walking, muscle stiffness, or pain or prickling sensations in the limbs. Although many of these symptoms can fall under the umbrella of other diseases, it is important to understand who is more at risk for developing a disease like this to avoid any kind of confusion. According to medicinenet.org, the cause of MS is unknown. But over several years, scientists have been able to determine risk factors that make someone more prone to MS. Those factors are genetic, environmental, and immunological factors. If a family member has MS, it is more likely that you will develop MS. However, that does not mean that you will not get MS, which brings me to environmental factors. In the environment, there are certain toxins that can trigger the onset of MS. The toxin named epsilon could be found in soils. When a person is exposed to this toxin epsilon, it can create neurological damage on the nerves, much like how we see in MS, which in conjunction with that kind of damage, immunological factors can also contribute to MS. If a person is not fortified with vitamin D, or if their immune system is simply at its lowest due to other illness, it can also trigger the onset of MS. Despite understanding the disease and its risk factors, MS can only be determined by diagnosis, can only be treated by diagnosis. So we must determine diagnosis first through either blood test, MRI test, or spinal test. According to healthline.com, it states that MS is not equal and does not affect everyone in the same mannerism. So once you are diagnosed, treatment can range anywhere between getting medications for muscle relaxants such as cyclobenzaprine. You can also use Ambria to help with the walking if you're having trouble walking, and nortriptyline for numbness or prickling sensations in limbs. Again, these are just some of the medications that are commonly used but not limited to only these usage. Now that I have informed you more of the disease, I hope that you can see as to why people like Elizabeth struggle with this rare disease that does not treat everyone equal. Although we have an understanding of what MS is, what the risk factors are, along with diagnosis and treatment, we must remember that the more knowledge we have, the better the outcome for people like Elizabeth. Although we cannot see the damage or physically feel the damage, the disease must be treated as equally as any other chronic disease. Any questions?
Yes. You mentioned soil, that it's in the soil, or what parts of the United States is that in?
So the toxin is found in any kinds of soil, and they haven't determined which specific type, but they have found a pattern in the soils, which is usually people who are in the United States above in Canada, United States up in Canada, and Northern European countries have been the most people diagnosed with MS.
People over the 70s, most risk.
People over 70 does not mean you will get MS, but you are at higher risk, possibly because of the low immune system. As we get older, our immune system gets more prone, more susceptible.
So what if I am encountering one or more symptoms? What should I do?
Go to your doctor, and then they will do an analysis, either blood test, and then investigate further.
Okay, thank you.
That's it.
Thank you.
Thank you.
Bravo.